recording of the band's winner, Thierry Lockhart. I am urging you to practice social distancing to prevent the spread of COVID-19. Avoid large gatherings, and if you have to stand in a line, make sure you are 3 feet apart from the other person. Get vaccinated today, protect yourself, and be responsible.
And I urge you, get vaccinated. It is safe and it is effective. Stop the spread, help the fight, and make the choice that is right. And let us unite and do the thing right. Man and woman, let us join in this.
Good evening and welcome to this week's edition of Roundtable Talk. Of course, we can never get too tired of this story. COVID-19, a lot has happened since our last program, and this evening we have with us medical registrar, Dr. Franklin James, and medical practitioner is joining us by Zoom.
Hello.
Dr. Malcolm Grant, who has been here with us before.
Not
Good evening,
hearing.
gentlemen, and welcome to the program.
Good evening.
So in the US, 1 in 500 Americans have died from COVID since the country first reported its first infection. Closer to home, in neighboring Grenada, health officials are predicting that half of Grenada's population could get COVID within 2 weeks. We have had one death within the last couple of days, adding to 13, the total number. Tell us what's trending here in St. Vincent and the Grenadines, Dr. James.
Well, we have noted a significant increase. Remember, we had a spike at the end of December, January. Things sort of settled down, but we have recently noted a spike. And what is also significant that we have noted in this spike, we have noted that we have been having some variants. As a matter of fact, we think we have Delta, Mu, and Gamma. Now, what is a variant? What happens is as the virus enters the body, it invades the cells and takes over certain mechanisms of the cell. And then it starts to replicate or multiply rapidly. Now, in the multiplication of the virus, you would get errors in the genetic sequence of the virus. As the virus continues to multiply, you get an increased amount of errors, or as we call them, mutations. When these mutations get to a certain level or number, they can modify certain characteristics of the virus. And that is what gives you a variant. Now, a variant can be weaker than the original. It can be just as strong or virulent, but it can be stronger or more virulent. And the variants that we are most concerned about are those that are more virulent. So you can start with a variant that is under monitoring, and then you can have a variant of interest. Now, in this case of the variant of interest, there's preliminary evidence of a number of things. Increased capacity of the virus to bind to the cells, increased capacity of the virus to spread, increased capacity of the virus to cause serious disease, hospitalization, and even death. And the capacity or increased capacity of the virus to evade vaccine-related immunity, diagnosis, and treatment. Now, you also have variants of concern. This is where the before mentioned characteristics have been confirmed and established as existing. Now, in terms of variants of interest, there are a few variants of interest, but the most important ones are the Lambda, which was first discovered in Peru, the Mu, that was first discovered in Colombia. In terms of variants of concern, up until now there are 4. The first was the Alpha that was discovered first in the UK. The Beta that was first discovered in South Africa. The Gamma was first discovered among some Brazilians who went to Japan. And the Delta, which was discovered in India. It is important to note that variants come from mutations. So you get variants because the virus is mutating.
What causes a virus to mutate?
The virus mutates because it is multiplying or replicating, and in the process of replication, you get errors in the genetic sequence. So as it continues to multiply or replicate, you get more errors, and after you have a certain amount of errors, then they're sufficient to change the characteristics of the virus. So for example, it is noted that, for example, the Delta is said to have about 40 errors or mutations. The Mu has around 21, and the Gamma has about 17. So as the virus spreads, it multiplies and it mutates. Some mutations are going to be insignificant in that they give you a weaker strain. Some may give you a strain that is just as the original strain, as virulent, but some would give you more virulent strains, and these are the strains, for example, the Delta, which is a much more virulent strain than the original virus, and this is where the problem is.
Okay, so Dr. Grant, we have 3 variants, or have identified 3 variants already in St. Vincent and the Grenadines, the Delta, Gamma, and the Mu. Dr. Grant, what's the difference between these 3 viruses? I know Dr. James said that one is more virulent than the other.
Yeah. Of all 3, the Delta is by far the most virulent at this point in time. Not that the others we can turn our noses up at and ignore, but the Delta is as contagious as chickenpox. And the average person who's been infected with the Delta is going to infect 5 to 6 others, which is much, much more, many more than the original novel coronaviruses. As a result, it tends to spread more easily because it binds, it has a much greater affinity for the receptors, the ACE2 receptors, especially in the upper respiratory tract. It tends to make people sicker. It tends to, interestingly, attack the young. A lot of under 40s, a lot of children, which wasn't necessarily the case with the original coronavirus. And as a result, a lot more young people are ending up in hospital and even dying from it. In neighboring islands, we had last week a 28-year-old St. Lucian lady who died, and in Grenada, we've had a few young people under the age of 30 who have actually died from from the coronavirus, and we strongly suspect the Delta. The Mu and the Lambda are variants of interest, but looking at their patterns and looking at where places that they've been found before, they do not seem to become the dominant strain. The Delta is by far the most dominant strain worldwide at this point in time. And it seems as though the uptake that we are seeing in this part of the world is more than likely related to the Delta variant. Although the confirmation still needs to be made, while we can diagnose you with an active infection, we can't necessarily tell immediately what type of variant. This sample has to be sent off to a special lab in Trinidad, which then actually types the variant so that we can know what's within the community. But in just looking at its pattern, certainly in the neighboring Caribbean islands, it's more than likely the Delta is the predominant variant. And there's no good reason why that shouldn't be the case here in St. Vincent. The other thing with the Delta, you're much more likely to get breakthrough infections. It's in people who are vaccinated. Vaccines are still highly recommended because it gives us our best fighting chance to keep the Delta at bay. But in a small percentage of individuals who are vaccinated, it's very small, the percentage, you do get breakthrough infections. And very, very unfortunately, in an even smaller percentage, you do get a few deaths. And this occurs generally in the immune compromise, which can be either as a result of disease or medication. It can occur in the frail and in the elderly. And although this is few and far between, it can happen. But again, it must be emphasized that even if you are immune compromised, elderly or frail, you still go ahead and get the vaccination because it still gives you your best fighting chance to keep the Delta-induced COVID infections under control.
Okay, we'll take our first break and come back in just a moment.
Update. KOSCAB SPG Limited donated generators and other accessories to the Ministry of Education and National Reconciliation. Ambassador Peter Shelley Lan of the Republic of China on Taiwan to St. Vincent and the Grenadines presented a letter of credence to Her Excellency Dame Susan Duggan and Dr. Ralphie Gonsalves. And the Ministry of Agriculture, Forestry, Fisheries, Rural Transformation, Industry and Labor is currently conducting a national parrot census of the Amazona Gildingi. We'll have these stories and more coming up at 7 p.m. on the VC3 News Update.
Friday, September 17th, there'll be thousands of dollars to be won. A lotto jackpot of $105,000. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next lotto jackpot, $105,000.
Welcome back. As we get back into this second segment, someone had a query, not particularly from this link, but something that I saw. And they were wondering if persons were in quarantine when they found out they had a variant, how do they now say there's a local case of this variant? When you say local, what does that mean? That it generated here? How did it start? That's the confusing part, I see.
No, I think you say local because if there's no evidence of recent travel from outside. So if it is somebody who within the past 14 days or so has not been outside and who has not had any known interaction with somebody who recently came from outside, then the only other conclusion is that it is local. Because you see, we act based on evidence, not supposition. So if we cannot identify a recent history of travel or recent contact with somebody who recently traveled from outside, and this travel is from outside, then the conclusion is made that it is local.
So it's a local mutation?
No, the mutation is not local. It came in, but has been circulating, most likely has been circulating around. So the mutation, not the mutation that is local. It originally came from outside.
Right, but it wasn't picked up.
It wasn't picked up from somebody who recently came in. It was picked up in somebody who, in the community,
who would have contracted
it, so it means that we suspect that it has been circulating for a little while
before it was
being
picked up. Okay, Dr. Grant?
So, in other words, it was more than likely contracted within the local community. So it was more than likely contracted from someone else who had it, and not someone locally, and not someone who recently came into the country. So that's what is meant by local. It's not that the virus originated locally. It is that's worrisome, because it means that there are more than likely others within the community that also have it.
Okay.
Another significant
but just have not been detected as yet.
Okay.
To make is that variants mutate, variants can get more virulent. So, for example, a Delta can become a Delta plus, more aggressive than the Delta
the original
Delta that we have presently, and that is troubling. Another point is that although the mu is a variant of interest, but it's a significant variant of interest because it has been noted that the mu has a significant capacity to evade vaccine-related immunity. That is also somewhat troubling.
Okay, how long does it take for one to, I know that the sample has to be sent overseas for a definitive diagnosis, to know whether it's a variant and what variant it is. So how long is this process?
It takes about 3 weeks, because this one lab in Trinidad has to be doing typing for a number of countries in the region. So I imagine that their workload is heavy. So it takes about 3 weeks for that result to come back to us.
And within that 3 weeks, of course, the affected person or persons would have already,
in most cases, have a negative test and have recovered in most cases that we have seen. The important thing is that because the person has been diagnosed as COVID positive, then there are measures that are taken to isolate the patient, keep the patient sort of quiet, and test the contacts. So contact tracing is done. Contact tracing is done. So the person is not left to wander about the place while we look and check for the type in.
Yeah. Basically, everyone who is tested positive is treated the same way. And you just have to assume the worst case scenario. So whether or not they're a Delta case or they turn out to be one of the less severe, I don't want to say milder, they're treated the same way. They're isolated the same way, and they're not allowed into the public domain until they have a negative swab. So it's great to know. It's great to know what variant they have, and it's good to know for epidemiological purposes. But at the same time, at the end of the day, we treat everyone the same in terms of at the time of diagnosis. Okay, your swab is positive, well then you have to go into quarantine, and you can't leave quarantine until you have a negative swab.
Is it likely that we may well have a lot of cases out there that have not been identified? How possible is that?
The fact that we discovered this local, we are discovering local variants that are deemed to be local, indicates that there would be other cases out there with the variant. As to whether it is widespread or the degree of the spread, we're not certain. But obviously, if you have a variant, a local spread of a variant, there are going to be others out there with that variant.
Okay, you indicated earlier that there has indeed been a spike. It's quite evident. The numbers clearly demonstrate this. There has been a spike within recent weeks. Any guess as to what may have caused or what is causing this spike at this particular time?
Well, it's what's happening in the Caribbean. It was inevitable. We have a lot of, how should I put it, unsanctioned or not even recognized cross-border travel. I have, I've heard from even Union Island, there are people who have traveled back and forth between Union and Carriacou, Petite Martinique. There is that spike in Grenada. There are people one of the people I understand who turned positive in Union is somebody who travels often between Carriacou and Union. And the people in St. Vincent, in Union, travel between Union and St. Vincent all the time. So, we would love to contain it, but it's almost impossible. And it becomes even more challenging when you have so many people disregarding protocols. You look around, a significant percentage not wearing their mask. One, if they're wearing it inadequately or inappropriately, not covering their nostrils. And, the St. Vincent, only a little over 10% of our population is actually vaccinated. So this is a very predictable situation. And in countries where they had lower numbers, certainly in Grenada, they had a lower number in terms of total number being infected, total number of deaths. They have surged ahead in next to no time. And if we're not careful here, St. Vincent is going to follow along a similar path. St. Lucia is way out of control. St. Lucia over 100, I think, and 12 to 120 deaths. One day last week, there were over 250 new cases. Yes, St. Lucia's population is 1.5 times ours, but at the same time, they're seeing phenomenal numbers. And St. Vincent, we're throwing caution to the wind. And I'm not speaking on an official level, but I'm speaking on an individual level. A lot of people are of the erroneous opinion that, this is something that will affect other places and it's not going to affect St. Vincent. And essentially, and unfortunately, and sadly, the chickens are coming home to roost.
Okay.
No, you have a situation where you have low levels of vaccination. Coupled with that, you have variants that are more capable of evading vaccine immunity or the immunity of the body. So it is obvious that you're going to have increases in cases. Also, you have, now we know that basically there are 4 basic pillars to prevent spread. Proper use of face mask, physical distancing, hand sanitizing, and vaccination. And if people are violating basically these or most of these 4, it is obvious that you're going to have increase in cases. I mean, it is not rocket science, it is the obvious.
Okay, we'll talk some more about that when we come back in just a moment.
I am Shakel Bob. I am a former Miss Pitani, a former Miss Rural SDG and Miss LCD contestant and runner-up. I'm a lawyer by profession, but a pageant lover at heart. Do not let the negatives prey on your mind, because a stitch in time saves 9. So, it's COVID vaccination time. Get vaccinated today to reduce the impact of COVID-19 in St. Vincent and the Grenadines.
And I urge you, get vaccinated. It is safe and it is effective. Stop the spread, help the fight, and make the choice that is right. And let us unite and do the thing right.
This evening on the VC3 News Update, KOSCAB SPG Limited donated generators and other accessories to the Ministry of Education and National Reconciliation. Ambassador Peter Shelley Lan of the Republic of China on Taiwan to St. Vincent and the Grenadines presented a letter of credence to Her Excellency Dame Susan Duggan and Dr. Ralphie Gonsalves. And the Ministry of Agriculture, Forestry, Fisheries, Rural Transformation, Industry and Labor is currently conducting a national parrot census of the Amazona Gildingi. We'll have these stories and more coming up at 7 p.m. on the VC3 News Update.
So is this... Welcome back. Doctors, a quick question. Well, maybe not so quick, but can a vaccinated person infect another vaccinated person?
Yes, that is possible. As we know, no vaccine is 100%. With every vaccine, you're going to find a small percentage, a very small percentage of persons who may not seroconvert, as we say. So a person may be vaccinated but not immunized. And it is noted that they are seeing persons who are vaccinated with similar viral loads to persons who are unvaccinated. So a person who is vaccinated but not immunized can infect another person. And as I said before, no vaccine is perfect. Perfection only exists on the other side of eternity. So you are going to find a few persons who are vaccinated but not immunized. So that is possible. The important thing, it is not very frequently occurring, but it can happen.
Have we seen any of these?
No.
Sorry, it's not frequently occurring. And what needs to be emphasized is that even though you may have what they call, vaccinated people being able to transmit it, it's for a much shorter period of time compared to the actual vaccinated. The vaccinated person, if they able to transmit it can only on average do that for about 2 to 3 days, where the unvaccinated person could do so for a week plus, okay? So there's a big difference, but it needs to be emphasized. This is a very, very rare occurrence, and it's much more likely to occur in a certain subset of the population. In other words, individuals who have less than a robust immune system, either as a result of maybe having some illness, they may be HIV positive, they may be suffer with leukemia, have some type of cancer, they may be on chemotherapy, they may be on certain drugs, methotrexate, cyclophosphamide, they may even be on prednisone. But I'm not knocking these drugs. These drugs are necessary in most cases to keep certain diseases under control. But the side effect of these drugs that I did mention, sometimes they suppress the immune system. So as a result, you don't get that quality immune response from your T and your B cells. And as a result, you may not be able to fight off the invading organism to the same degree as somebody who has a robust immune system. And that's why we're talking about booster shots, especially in this subset.
Okay. Someone was making the point that the medical fraternity or the powers that be are aware that the vaccinated can be spreaders. Why then are they authorizing vaccinated activities? Well, they're saying it is well known that these events were super spreaders as well. Well, we don't know that. There's no evidence to suggest that. But is it okay for vaccinated or events for the vaccinated to happen?
It is not my judgment call. So I really don't want to vent into that.
Okay. You said that people with viral loads, right? Vaccinated people can have the same amount of viral loads as the unvaccinated. Can you explain to us what you mean by viral load?
No, as I said early on, when the virus it enters the body, it can attach itself or bind to the cells, and once it gets into the cells, it multiplies or replicates. Now, if somebody has very little immunity, then the virus has the leeway to enter the body, enter cells, and to replicate or multiply as much as it wants. So, as we said before, they are vaccinated persons who, for certain reasons, do not develop sufficient immunity, and therefore their immune system cannot prevent the virus from multiplying. It is significant to note that when a person's immune system responds to an invading organism, or if the person has the antigen, or antigen means the same disease-causing organism. Now, the antigen can enter your body fundamentally in two ways. One, through the disease, another way through vaccine. Now, the body would develop certain immune responses. One, for example, what is known as the humoral B cells would produce antibodies. Generally, antibodies are fundamentally of two types, what we call neutralizing antibodies, and that would prevent the virus from entering your cells and therefore prevent the virus from multiplying or replicating. And they may also produce what are known as binding or non-neutralizing antibodies. Also, you have some what we call cellular immunity or cellular response, where T cells are produced, and those can also help to fight off the disease-causing organism. Also, persons develop what is known as immune memory. So, the immune system comes into contact with the disease-causing organism or the antigen via the vaccine. It causes our immune response, production of antibodies, but there's what we call an immune memory, where the immune system, if it comes into contact with that organism, sometime later on could say, look, I know you, I have dealt with you already, I have defeated you, so let me organize my mechanisms, my processes to deal with you again. So that is basically immune memory. So these things.
Okay, who is not a good candidate for the vaccine? People around me have found all sorts of excuses. One of the most common ones being, I have a history, or my family has a history of clotting. And then someone else here is asking, can someone with sickle cell take the vaccine?
Okay. First of all, yes, someone with sickle cell can take the vaccine, and it is highly recommended. There are certain individuals who are at a much higher risk of getting coming down with a severe COVID infection as a result of being exposed to the COVID-causing virus, which is the SARS-CoV-2. These individuals include those who are asthmatic, those with cardiac disease, cancers, those who are overweight, those who are elderly, those who have sickle cell, those who are immune compromised, those with kidney disease, those with liver disease, those who are on certain types of medication, diabetics. I must emphasize diabetics, because I've heard over and over from patients who have said that their doctors have actually told them that they're not good candidates for the vaccine because they're diabetics. People who are hypertensive, who have high blood pressure, all these individuals should take the vaccine. And individuals around those type of individuals, in other words, I called out maybe about 8 to 10 different categories of individuals who are more likely to come down with a severe type of COVID, which can result in hospitalization and death. And people may say, look, I don't have any of them things. So I obviously am not a candidate for these vaccines. But it is now shown that, okay, first of all, okay, I emphasize, this is when you know you have these illnesses. There are a lot of people who are walking around with heart disease and don't know that they have heart disease, or for that matter, kidney disease, liver disease, even diabetes, and are not aware that they're diabetics. Cancer, a lady with breast cancer, by the time it's diagnosed, it's there on average for about 3+ years. Okay, so again, because you've not been diagnosed with any of these conditions, it doesn't mean that they're not there. And furthermore, if you are vaccinated and you are around these types of individuals, you reduce the chances of them being exposed to the SARS-CoV-2 virus, say compared to if you are unvaccinated. Yes, the vaccinated can still pass it on, but as mentioned, the chances are significantly lowered, and by the fact that the amount of virus that you're carrying remains around the amount of virus that you're carrying is needed to infect someone else remains around for a lot shorter period of time. So the period that you're infectious is cut down considerably. Okay, so in terms of absolute contraindications, maybe individuals who are allergic to some of the components or any of the components within the vaccine. And if persons are concerned about that, especially if they have a strong history of allergies, they can easily Google the components of any of the 3 vaccines that we have available locally, which is Pfizer, Sputnik, and the Oxford AstraZeneca.
Okay, when we come back, I want to talk a little bit more about the 3 vaccines that we have available. And someone was asking whether persons with severe allergies or if someone who has had surgery can take the vaccine soon after doing that surgery. You'll answer when we come back from this final break.
September 17th, there'll be thousands of dollars to be won. A lotto jackpot of $105,000. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next lotto jackpot, $105,000.
I am Hans John, the 2019 Vinci Ragasoka Monarch. I took the COVID-19 vaccine, and so should you. Let's be an example to others. Get vaccinated today and help control the spread of COVID-19.
Vaccinate if you want to eliminate the spread of the virus in our place, and do not procrastinate, but rather let us vaccinate. Get vaccinated today.
This evening on the VC3 News Update, KOSCAB SPG Limited donated generators and other accessories to the Ministry of Education and National Reconciliation. Ambassador Peter Shelley Lan of the Republic of China on Taiwan to St. Vincent and the Grenadines presented a letter of credence to Her Excellency Dame Susan Duggan and Dr. Ralphie Gonsalves. And the Ministry of Agriculture, Forestry, Fisheries, Rural Transformation, Industry and Labor is currently conducting a national parrot census of the Amazona Gildingi. We'll have these stories and more coming up at 7 p.m. on the VC3 News Update.
Welcome back. Before the break, we had two questions about whether someone with severe allergies or someone who has just had a surgery can, in fact, take the vaccine just after doing that surgery.
Yes, there's nothing that precludes you from being able to take a vaccine after having surgery. You're asking something about vaccine. Oh, all right, go ahead, Malcolm.
No, sorry. I thought you finished. No, I was saying all vaccination centers across St. Vincent have adrenaline, also known as epinephrine. So if there's a severe allergic reaction, that's why they tell the recently vaccinated to hold on for 15, 20 minutes. So you will notice the severe allergic response starting, and you can give the adrenaline or epinephrine, same difference, and it immediately reverses that reaction. So, having a severe allergic reaction is not an absolute contraindication. Sorry for crossing it. Didn't mean to.
So tell us about the three vaccines that are now available in the country.
Before I get to that, there's a misconception out there. You hear people talking about the COVID-19 vaccine. There's no the COVID-19 vaccine. There are a number of COVID-19 vaccines, and most with different mechanisms of action. People tend to lump and say, there's no D-COVID. There are a number of vaccines. As a matter of fact, the vaccines that we have here, two of them use what we call viral vector. One is a messenger RNA vaccine, which is the Pfizer, which is a new technology. The AstraZeneca and the Sputnik are viral vector vaccines. There are other vaccines such as Sinopharm and Sinovac that are what we call inactivated virus. There's Abdala in Cuba. I think that is a protein subunit vaccine. There's also the Soberana, which is what we call a conjugate vaccine, which is a combination of a weak antigen with a stronger antigen. So the first thing that there's so you can't lump them. Different vaccines have different efficacy and effectiveness. Now the three vaccines that we have here, the first vaccine that was administered here was the Sputnik 5. As a matter of fact, I happen to be the first person, local person in country who took a COVID-19 vaccine. We also, that was on the 1st of February. Soon after that, we rolled out the AstraZeneca, or the Covishield brand of the AstraZeneca, which is because the Covishield brand came out of India. And now we have the Pfizer, which is a messenger RNA, which is the combination of Pfizer, and there's a German company, BioNTech. So this is a combination of American, US, and German. Company that came up with the Pfizer vaccine.
Okay. Someone is asking about pregnant women. And is it recommended for someone who has cancer and diabetes to get the vaccine? Definitely yes. Dr. Grant did indicate that earlier on, that it really is advisable, especially for people with diabetes, to get that vaccine. Can you mix and match the various vaccines?
There's mixing and matching occurring in, for example, the UK, between the Oxford AstraZeneca and the Pfizer studies, which mix and match the Sputnik as well as the Oxford AstraZeneca. I can't speak for the official policy of the Ministry of Health, but I can see down the road that whereas, as far as the boosters are concerned, there's probably going to be some degree of mixing and matching. It has not been shown to be harmful, and where they have mixed and matched, quite often they have gotten a pretty good and a very satisfactory immune response.
It has approved mixing and matching, so that there's a document out that speaks to that. So we are already here speak to the issue.
So these three that we have can be mixed and matched?
Yes, they can be mixed and matched.
Okay.
Well, I know one person who wasn't too happy with the reaction to her first vaccine. This was 6 months ago, and she took the Pfizer recently, which wasn't available then, and she was very, very happy with the, with the fact that there were virtually no side effects.
Okay. Before we go, I don't want to go without talking about Ivectomate, because it's been trending recently with the news that people locally have in fact been using it to treat their COVID infection.
All I know about ivermectin is that I have bought it in the past to treat my dogs for worms. And that is where it stands with me.
Right.
And in treatment for animals for worms. That's
essentially, I consider myself a scientist. I follow the science. And the only study that came out that seemed to suggest that it may have been effective was shot down because one of the papers was, the data was cooked, for the want of a better way of putting it. So yes, there is no good scientific reason why ivermectin should have antiviral properties. Antiparasitic maybe, but it's a totally different organism. And yes, we sometimes find things cropping up out of the blue, but this has been very, very carefully looked at, including, places like Brazil, etc., certainly across the United States, in Iran, in other countries across the world. And it has not been shown to reduce the severity of the disease or reduce deaths. Nobody can stop someone from deciding to use it on themselves. And the fact that they get better may just be the fact that they were going to get better anyway and had nothing to do with the ivermectin. But I think that they're taking a chance when they reject conventional treatment, which can make the difference between basically getting better and hospitalization, and in some cases death. And I just I know this wasn't a question asked, but quite often here in St. Vincent, people look at the COVID vaccine as well, most people recover. And I just want to emphasize the recoveries, when we see them in our statistics of over 2,000 recovered, just means that the person has had a negative swab for the SARS-CoV-2 virus after once testing positive. Now, recovery doesn't speak to the health of those individuals after being infected. And I just want to introduce a term which I'm very surprised. I've spoken to a few groups recently, and I would say, let's say the last 100 people I spoke to, less than 5 have ever heard about this term, long COVID. And long COVID, by definition, is whereby you have the infection for 8 to 12 weeks. Sorry, you have after effects of the infection for 8 to 12 weeks or more after being initially infected. And these symptoms can be very debilitating. So when you take the vaccine to protect yourself, you're not only protecting yourself from death, but you're significantly lowering your chances of long COVID. I had to get that in because a lot of persons have never heard of long COVID. And I think that's extremely important to get out there.
I'd like to highlight along that same line. A few months ago, I was listening to the news, and there was this guy in the United States who had COVID, apparently had recovered, but had an aspect of long COVID. He was hearing a constant buzzing in his ears for 24 hours a day, every single day. And it was getting worse. And you know what he did? He went out into the bushes and hung himself.
Yeah.
And I could imagine that if you hear buzzing in your ear for half a minute, it sends you almost mad. And for somebody to be hearing that for 24 hours a day, 7 days per week, these are things that are possible with COVID-19.
Anyway, if I have a little bit more time, I would elaborate on one of my patients who is really suffering with long COVID now.
Okay, I think we'll get an extra minute or so to do that. And while we're at it, I want you guys to explain to our viewers, listeners, what is the difference between COVID death and a COVID-related death? Yeah, if we can get that clarified somewhat. Yeah? Doc, you want to go first?
Personally, I'm not aware of a difference. I think it's just semantics, frankly speaking. COVID-related death, okay, the only difference I can see, COVID death is just purely due to COVID and COVID-related, more than likely COVID plus comorbidities. But I am just taking a wild guess here, honestly. But as far as I know, there's no difference. That's how some people...
It's a troubling classification to try to make. Because if you say COVID death, then you start to tell me that only persons who die from pulmonary or respiratory complications of COVID-19 can be considered to be COVID death, and that cannot be so. That is semantics, and that is something that you get from people, a lot of anti-vaxxers, who try strategies to try to say that persons are not dying from COVID, or some of the persons who we say dying from COVID or not. The fact that COVID has a relation to the person's death, it has to be seen, because without COVID, you can't show me that the person would have died at that post moment. So, to me, it's just something that persons are trying to. I really don't get into some of these semantics and these issues.
Okay, Doc?
Yeah, long COVID. I have a patient who contracted COVID in December last year, before the vaccines were available in St. Vincent. And she still reports loss of smell, loss of taste, and anxiety as well as depression as a result of these symptoms. Now, some people would dismiss, it's a big deal if you lose smell and taste. But this lady has related these scenarios to me. Once a neighbor has actually called out to her, smelling the burner has gone off on her gas stove and the gas is still on. And she wasn't able to smell it. Yet a neighbor was. Consider the potential dangers. She has been in the kitchen preparing a meal while on one occasion a neighbor, the other occasion her stepfather in a back room, has shouted out to her on separate occasions that look, the food is burning. The food was burning right there near to her and she couldn't tell. On another occasion, her daughter, she made eat some food because as far as she was concerned, it was okay. And the food was off, it was spoiled. Daughter had food poisoning, okay? So I'm saying all this to say that, okay, here's someone who is suffering with long COVID symptoms. And as she said that cooking is something that she likes. No, she can't do it by herself because she can't taste the food. She can't tell you if it has too much salt, too little salt. She can't tell you if it is too sweet, too sour. And okay, long COVID doesn't only cause these couple things that I mentioned. It causes something called brain fog, where you can't concentrate, you can't think. It causes diabetes in some individuals. It causes shortness of breath on rest, shortness of breath on minimal exertion. I mean, the analogy I use, I tell patients, think about 8 years ago, they had an epidemic in the Caribbean of chikungunya. And people who suffered with chikungunya back then are still complaining of tiredness, joint aches and pains now, quite a lot. There's no official thing as long chikungunya, but that is like the equivalent of long COVID. And long COVID, from what we can see, is going to be very persistent, going to be very debilitating in a lot of people. And up to 20% of individuals with long COVID cannot return to work. And there's no good reason why that can't happen here in St. Vincent. And there are even children in the UK who are documented cases of long COVID. So I tell patients, this is something that you need to be aware of, especially when you're rejecting the vaccine, because you may end up with, recovering in that your swab becomes negative, but you may end up with something that you're just not a functional individual within society any longer.
Okay, that's our program for today. Thank you very much, Doctors James and Dr. Grant. Thank you again for coming on as usual.
Thanks.
Where did the time go? But that's it for today. We'll see you again. Thank you for tuning in. See you again next week, Wednesday. Good evening.
Good evening.
Thank you.
All the best. Take care.